Hi, my name is Ramona Danielson, and I'm presenting on behalf of my colleague Grace Najau at the North Dakota Department of Health and Brenda Vincent, who is also at North Dakota State University, as I am. We are presenting a poster on our research about exploring the impact of a positive COVID-19 test during pregnancy on North Dakota infant birth outcomes. Many studies have explored the impact of COVID-19 during pregnancy and have found an association between COVID-19 infection during pregnancy and greater risk for poor maternal and infant outcomes. Other studies have found that outcomes among pregnant women who tested positive and those who tested negative for COVID-19 were similar. In November and December 2020, North Dakota made headlines with among the highest COVID-19 positive test rates in the world. The present study examined whether infants born to North Dakota women with a positive COVID-19 test during pregnancy between April and December 2020 had worse birth outcomes than infants born to a woman in that same time period who did not have a record of a positive COVID-19 test. We merged birth records for that 9-month period with North Dakota Department of Health COVID-19 testing data. And that was a total of 8,747 births during that 9-month period. We determined there were no quarterly trends in birth outcomes from 2015 to 2019. Then performed a sensitivity analysis using January through March 2020 birth records. And our first identified case of COVID-19 in North Dakota was March 11th, 2020. So we were confident that January through March represented a period of time where there were not active cases among pregnant women in North Dakota. We compared birth outcomes among women who gave birth from April to December, who did and did not have a positive COVID-19 test while pregnant. And we found 311 North Dakota women who did have a positive COVID-19 test record in this period of time. We use propensity score matching to ensure covariate balance using a variety of demographic and health-related characteristics. We wanted to isolate factors that could potentially influence the likelihood of exposure to COVID-19 or factors that could impact birth outcomes. We wanted to isolate those factors from the actual impact of having COVID-19. We matched on the logic of the propensity score with a greedy algorithm using the PS-match procedure in SAS. Significance testing was conducted using chi-square. Our match variables were mother's age, marital status, Medicaid as a birth payment method, trimester that prenatal care started, WIC recipient status, race, smoking during pregnancy, BMI status, previous birth and previous preterm birth, previous termination of a pregnancy, hypertension, and education. And our birth outcomes were low birth weight, preterm birth, a stay in a neonatal intensive care unit, use of infant ventilation upon birth, a poor APGAR score, and delivery by C-section. Limitations to our methodologies include that women that did not have a record of a positive COVID-19 test in North Dakota may have tested positive in another state or may have had COVID-19 but were never tested. And due to a small incidence of infant mortality annually in North Dakota, we're not able to draw conclusions about this outcome. Our results, we found no quarterly patterns in birth outcomes based on the time of year of birth between 2015 and 2019. And our sensitivity analysis showed no significant differences in birth outcomes between those women who tested positive for COVID-19 from April to December and women who gave birth January to March, which was prior to COVID-19 in North Dakota. And birth outcomes to North Dakota women who did have a positive COVID-19 test included 6% of infants born at a low birth weight, 10% born preterm, 10% stayed in a NICU, 8% received ventilation, 4% had a 5-minute APGAR score less than 7, 29% were delivered by cesarean section. After matching, our covariates were considered balanced between the women with a positive COVID-19 test and the matched controls with standardized mean differences of less than 0.1. And differences between the two groups were not significant. And you can see these results in table 1. So after controlling for covariates that could potentially influence the likelihood of exposure to COVID-19 or that could impact birth outcomes, We found no significant differences in infant outcomes based on whether the woman tested positive for COVID-19 while pregnant. So our study found that having COVID-19 during pregnancy in North Dakota was not associated with poor birth outcomes. This study is also an important use of linking data files to learn about the impact of COVID-19 on newborns in North Dakota overall, and to learn if it had a disparate impact on birth outcomes for specific populations. The risk of poor outcomes is rare, but measures to prevent infection from COVID-19 during pregnancy can further reduce the risk. And recommendations from the Centers for Disease Control and Prevention continue to be for pregnant women to get vaccinated, even while pregnant, and to take measures to reduce risk of exposure. Thank you.